My name is Ajay Wilson. I'm a head and neck surgeon in oral and maxillofacial and reconstructive surgery. I'm based at South Tyneside and Sunderland NHS Foundation Trust. I'm here to talk to you about oral cancers, and oral cancers can also be known as mouth cancers, and these cancers commonly develop from the lining of the mouth and are called squamous cell carcinomas. These cancers typically develop as a sore or a lump or a bump in the mouth that lasts for more than 2 weeks, or as a lump in the neck. They typically tend to affect the lip, the tongue, the floor, the cheek, the maxilla, and the jaws. Oral cancers can be life-threatening if they're not diagnosed and treated in a timely fashion. An early diagnosis is key to giving the patients the best chance at curing the cancer and maintaining the function and the impact that cancer and its treatment can have on the individual. Should you or your doctor or dentist suspect a mouth cancer, you should be referred to see an oral and maxillofacial surgeon on a 2-week wait pathway. The most common symptoms of mouth cancer are, as explained, a sore or a lump or bump in the mouth that lasts for more than 2 weeks, or red or white patches seen in the mouth or throat, usually picked up in routine examination by the dentist. The diagnosis of mouth cancer is usually confirmed by examination, carrying out a biopsy, and also by carrying out scans, the commonest scans being CT scans, MRI scans, and CT PET scans. Once a diagnosis of mouth cancer is reached here at South Tyneside and Sunderland NHS Foundation Trust, you'd be treated for and cared for by a caring group of multidisciplinary team involving surgeons, doctors, nurses, speech and language therapists, dietitians, clinical psychologists, and physiotherapists, to name a some. We are fortunate to have a team of world-leading experts who offer contemporary evidence-based treatments for mouth cancer at South Tyneside and Sunderland NHS Foundation Trust. Treatments for oral cancer are purely dependent on the size, the type, and the stage of the cancer, and every effort is made to cure but also maintain form and function. The most common treatments for oral cancer are surgery, radiotherapy, chemotherapy, and more recently, immunotherapy. Surgery and radiotherapy are by far the mainstay treatment modalities that are used independently or as a combination with an aim to cure the cancer and also maintain function. The treatment for cancers, if diagnosed early, are simple, and recovery from treatment is also more predictable. Patients with early cancers are usually offered a removal of the cancer and a neck dissection to remove the lymph nodes, or here at Sunderland Royal Hospital, we offer patients a technique called sentinel lymph node biopsy, which removes a focused limited number of lymph nodes as opposed to a neck dissection, which removes most of the lymph nodes on that side of the neck with its consequences. Sentinel node biopsy is currently only available in the Northeast at South Tyneside and Sunderland NHS Foundation Trust. The more advanced cancers, however, that present are treated with surgery, usually followed by radiotherapy. And surgery for these type of cancers usually involves removal of the cancer from the mouth, removal of the lymph glands from the neck, and microvascular free tissue transfer surgery, which involves transferring or transplanting skin, muscle, or bone, depending on the requirement, along with its blood vessels to the mouth or the head and neck region. Patients that undergo this type of surgery typically spend a day in intensive care unit and then spend 10 to 14 days on the ward. The aim of treating patients with mouth cancer is to achieve cure from these cancers, but also reduce and minimize the impacts cancer and its treatment has on patients. One such example is we encourage our patients to keep swallowing through their treatment. The swallowing therapists typically meet along with the multidisciplinary team with the patients prior to their treatment and also meet them on a weekly basis through their treatment to encourage and assist each individual to maintain their best function. As with all cancers, Prevention is better than cure, and for mouth cancer, stopping smoking and drinking alcohol happens to be the best possible lifestyle change one could make to prevent these cancers from forming in the first place. If you have any concerns about what you have heard today, please contact your CNS. Thank you.